My name is Tony Breitbach. I'm on the communications team for Interprofessional.Global. Allison Power, who's also on our communications team, who coordinates the global cafes, is here. We are very proud to present this month's Global Cafe, Interprofessional Teaching and Medical Education, Coffee Without Pain, Global Cafe with Mariana, Siviero, and Fernanda, Brenneisen, Mayor. So I'll turn that over to you. I'm looking forward to your presentation. Thank you.
I'm very happy to be here with you, and I'm grateful for this opportunity to talk about our work on interprofessional teaching in medical education. I am a general practitioner, and for the last 5 years, I have been studying pain education among professionals, students, and patients. In present moment, I'm working and living in Switzerland, and I'm looking forward to engaging with more projects involving interprofessional education. I'm here with my friend and colleague Fernanda to a short presentation about our experience and how we got to the patient groups as a potential strategy to bring interprofessional education to practice and to learn about from and with each other. It's also really important to say that we declare we have no conflict of interest related. We have no financial or personal relationships that have influenced the content, our outcomes of this work. We would like to give special thanks to the organizers, to all of you who are joining us here online, and a special thanks for the Pontifícia Católica Universidade do Paraná, where I particularly did my medical education, where I had the honor to work as a preceptor and to meet such a special team as Fernanda, and the opportunity and support to develop the chronic pain management outpatient clinic. And before I begin, I want to emphasize how meaningful this moment is for us, because this presentation holds memories of our teamwork, resilience, and many lessons that we've learned. So today, more than presenting a project, we want to share a piece of our journey. And for that, I will start with some background on chronic pain and interprofessional education. Then I will show a timeline of how our project developed. After that, I will share a video and graphics from some of our activities. And finally, Fernanda will continue with the second part of our presentation. The background of the project came from a great requirement. We wanted to support the needs of patients with chronic pain. In one hand, we have chronic pain as a multifactorial condition, so a multidisciplinary assessment happens almost naturally. And neurosciences also reinforces that we should understand pain, especially chronic pain, as a disease and not just as a symptom. Furthermore, pain education can actually be considered a form of treatment, and learning about pain can, in a way, work like a painkiller. And in the other hand, interprofessional education under IPE has become an important topic in medical training. And when we bring both hands together, patients with chronic pain can particularly benefit from an interprofessional approach, because chronic pain involves biological, psychological, and social factors. And the idea of learning about, from, and with each other becomes even more meaningful when we bring the patient into the team. This is when pain education becomes visible in practice, and when chronic pain care becomes a powerful field for delivering interprofessional education in academic settings. When I said that we would share our journey, it's because it was really a path to build our outpatient clinic at Pontifícia Universidade Católica do Paraná. Our activities took place done in our private university in southern Brazil. It's located in the city of Curitiba, Paraná. And our practical activities with medical students occurred during the semesters through the practical integration. It's a module of the academic curriculum. In 2019, during case discussions about headaches and low back pain, the idea for the interdisciplinary chronic pain outpatient clinic first appeared. And then we did a project. Our project was approved. And as soon as it was approved, so came the pandemic with COVID, and our outpatient care just stopped. And during this pause, as an alternative, we created remote self-management groups for chronic low back pain with guided physical activities that patients could then just do at home in the online form. And for 2 years, we followed the patients in this online self-management program and also developed telemedicine and remote education activities, including simulated consultations for our medical students. When we returned to the face-to-face care, our first idea was to bring several professionals together. And at this time, we formed a team of 4 to 5 professionals. And the main idea was to do a single consultation at the same time with many professionals. We had the opportunity to listen, to plan, to practice, and most importantly, to learn from each other and with time. Every Friday morning, we open our consultations with a clinical discussion. It was organized by the students, and we called it Coffee Without Pain. But time became both our greatest strength and our biggest challenge because we weren't able to attend many patients, and the waiting list started to grow up. So that motivated us to create a patient education group so the patients wouldn't have to wait so long for their first visit. And we already knew, based on neuroscience, that pain education itself would help with pain management once patients could learn more about chronic pain, physiopathology, and the mechanisms. Still under the name of Coffee Without Pain, we expanded a little bit the group, and we held 4 meetings each semester, so once a month, taking account on our academic schedule. It was like 4 encounters, and each meetings for one point of lifestyle. So we divided into health eating with nutrition and psychology, sleep habits with psychology, architecture, with the environment design, and physiotherapy with the sleeping positions, mental health together with the School of Arts, and physical activity with physical education and physiotherapy. We had a great participation from our students and patients, and of course, a lot of fun. And since images speak louder than words, we invite you to watch our video.
Is there sound with this? Here we go.
Oi, pessoal. Todo mundo animado?
So over 3 years, we treated 315 patients with a mean age of 56 years, and most of them were female. This is also in line with the worldwide epidemiology of chronic pain. And our team from preceptors and professors managed the clinic and teaching learning activities, guided these students during interprofessional care, and helped them how to organize psychoeducational groups. The composition of the groups, they varied according to the activity and the content for patient education. For example, the group focused on nutrition included the contributions from nutrition and psychology. Now I would like to kindly invite Fernanda to proceed her presentation and the presentation from the next slides. Thank you.
Thank you, Mariana.
Thank you, Mariana. Hi, I'm very happy and glad to be here. Thank you very much for this opportunity. I'm a psychologist and doctor of science in the main area education and health, and it was a pleasure and very nice to realize this work with Mariana together and our other colleagues, the patients and the students. In parallel, we try to register our work in research. We understood the importance and was a desire to have a service with care and education and research in parallel. So I would like to share some new results from our analysis is retrospective and qualitative study on the perspectives of students and patients on these interprofessional psychoeducational groups. Specific, these results was from the group focus on chronic pain and sleep health. We asked them, patients, also students, 2 questions. How was your experience in the patient psychoeducation group direct after we realized the group? And the second question was, how was it to work in a professional team? And we analyzed this both open and ended response using thematic content analysis. From the analysis of students' perspectives on the first question about the experience, emerged 2 categories. One, collaborative learning. They valued the learning from other professions, the students from other areas, and seeing how knowledge was connected. In the same time, they cared for the patients. For example, they said, I learned a lot from other fields and realized that everything is connected. It was wonderful. And second example, today we were truly able to work interdisciplinary, complementing one another and sharing knowledge. The second category was empathic engagement. This category captured the affective relation dimension, including empathy toward patients and high satisfaction with the interprofessional experience in the same time. highlighting the emotional involvement, pleasure, and meaning derived from interactions with patients and colleagues. They said, for example, the patients felt truly cared for. They perceived that. It was great to understand the patient's perceptions. I'm very grateful for this opportunity to experience interprofessional work. The analysis from the perspective from the patients about their experiences. From this analysis emerged three categories. The first one, belonging, reflects the experience of being welcomed, connected, and mutually recognized among peers, students, and faculty. The patient said, for example, there are people like me. They perceive it that as peer support. We are not alone. I felt very, very welcomed. I was moved because I felt understood. The second category, from the perspectives of the patients, was learning. This category encompasses the acquisition of new knowledge about pain coping patterns, self-care strategies, and aspects related to health and well-being. They said, for example, very instructive to learn more and participated more. I learned about sleep habits. The third category was satisfaction. Represents the positive and enjoyable experience of participating in the psychoeducation section. They said wonderful, was very good, I like it, I love it participating with these intensive words. Then we analyzed the second questions about the experience into working an interprofessional team. And from the perspective from the students emerged three categories. The first was motivation, captured the students' expressions of satisfaction, enjoyment, and engagement in working within an interprofessional team. One student said it was very good. Students and teachers did very well in their presentations and in creation a welcome environment, which made the experience wonderful. The second category was learning. They perceived the acquisition of skills and the expansion of perspectives on healthy education through mutual learning among students, teachers, and patients. One student said, a new experience that gave me a much broader view of healthy education. The third category emerged was collaboration, referred to planning, role distribution, integration among team members, and effective communication, including with patients. One student said we were able to plan and organize ourselves as a real team, each person contributing in a different way. Other students said, I felt that we built a good team today, learning from each other, teaching, and being open to listen to everyone. From the perspectives of from the patients about this interprofessional work, teamwork, emerged category satisfaction, positive emotions such as pleasure, gratitude, and overall appreciation of the experience. When patients said, wonderful, I didn't expect it to be so good. It was very dynamic, very nice. The second category, from the perspective of the patients, was learning. Patients' reflections on understanding group dynamics, actively listening to others, and learning from shared experience. It was a great learning experience. It was new, a different moment, one patient said. And the third category was psychosocial support. The sense of being heard, feeling integrated into the group, and participating actively in the process. One patient said, "Very good. I was moved because I felt myself understood. I couldn't express myself before." Another patient said, "We listened to each other." When we started our program, we was in medical curriculum that integrated the students from other health professions. And one gap was that we had at our initial time kind of education objectives, kind of interprofessional education objectives. And we perceived this gap, and then we started to study more about interprofessional education. And we tried to establish some educational objectives for this program. So we had just a minute. I can't see the slide. Sorry. We established educational. Then we have contact with the frameworks from IPEC, né? From C. And the educational objectives was, for example, understand the roles and responsibilities of different health and non-health professionals involved in chronic pain care. Other educational objective, collaborate effectively in planning and delivering interprofessional patient educational group for patients with chronic pain. Design person-centered education strategies that address the needs, experience, and perspectives of patients. And we tried to align these educational objects with the competence domains from these both frameworks. Demonstrate respectful attitudes, empathy, and active learning, listening toward patients and team members, communicate clear, recognize and support shared leadership and collaborative decision-making with team. We also designed interprofessional education objectives for each health area. For example, for medicine, to develop competences in person-centered care, interprofessional collaboration, biopsychosocial pain management, and pain neurological education. For the students from psychology students, apply psychological principles to coping with chronic pain and promote communication skills in team settings. Physiotherapy, to understand physical therapy approach to pain relief and integrated them into a collaborative care plan. And we innovated, including the students from architecture, was a great experience. And the educational objective was exploring how environment and spatial factors influence sleep quality and chronic pain and contribute with patient-centered education on sleep health. We perceive that we overcoming a lot of challenges in this journal. We come out with interprofessional education care and tried to do a little bit of research. We recognized our limitations of the program and the need, for example, to expand the number of students. We had a limited number of students, and the experience of the first years showed that was possible to provide interprofessional assistance and education for patients and students with chronic pain. We are, I think, very proud of this experience and very glad to have worked together, and we provided interprofessional care for with numerous patients. We provided interprofessional education with small but growing number of students, and this program was recognized by our accreditation system in Brazil, in our medical school in 2024. We developed the interprofessional learner outcomes, and at the moment we are analyzing these results. We did some research activities. We presented this work at AMI last year. We present and had the recognition in the IPEC forum in 2024. Two undergraduate students realized an initial research project. They present these results, and that was other outcome from our effort. This work I present also in the completion of my specialization in health education this year, and we are writing at the moment the results, and would like to, as soon as possible, publish these results in some 1 or 2 manuscripts. I'm in the end of our presentation, and I'd like to pass the words yet and open for Mariana, and after that for all of you. Mari.
Thank you, Fer. Thank you for your lovely presentation and your words. And I'm so glad that in this journey I could meet you, and we could bring to this idea, to this project, the interprofessional education, because the first aim idea was just to provide our patients the best care that we could, and to not let them waiting too long to have one first consultation. And when we saw that in the practice, what we were having was actually interprofessional education among our patients and students and all the teachers working together. So we were so happy, and we started to think, how could we collect actually our data, and how could we analyze better what we already had? And our main statement for it was like our few, alone we go faster, but together we go further. So it's good to have a journey, and even when you don't know exactly where you are going, you find out together that maybe your final destiny, it will be better than you could ever dream if you work with your heart and if you met people that work with purpose. That's the best view that we can have. So thank you. And as take-home message, I want to like to share with you that for us, the implementation of the interprofessional educational program in the care of patients with chronic pain appears to be advantage not just for the patients, but for the students as well, for us as professionals too. And interprofessional education becomes a goal not just for our work, but for our lives. Thank you so much for the time, attention, and we are here to
Yeah,
answer
thank you very
questions.
much. You both did a fantastic job. Thank you. Fernanda, maybe it'll be easier for the video if you unshare your presentation really quick, and then we'll do some questions. Does anyone have any questions that they would like to ask? I can start. You talked a little bit about the the impact of COVID on your program. You kind of got off to a great start, and then you hit some setbacks, and then you kind of reinvigorated it a little bit. Can you give any advice to anybody here on the call, or on the cafe about ways to pivot, ways to kind of maintain your momentum, and things that you did to move forward like that?
It was a surprise for us because it was the first semester, so we were ready and looking forward to start our attendance in the ambulatory with all the approbation and everything. And okay, now we have everything we wanted. We have a place, we have a list of patients, but we cannot receive them here. So we talked to the physiotherapy students, and they were doing as an experiment groups with patient care online. So we decided to provide for the low back pain patients that were the most of the big picture of our patients were from neurosurgery. So we just provided this attendance for them. We also have this study, and we can share with you. We presented as a poster in a congress. So my idea is that even when we start here and we think about something, we need to be ready to change our strategies and maybe to use the best way we can. I used to say like Hakuna Matata. We don't have any problem. We need to find out for solutions. Otherwise, it won't have, it's not a problem anymore. If we don't have any solution, it's not a problem anymore. So
Yeah, no,
there's another question here now.
Focus on,
Have you
yeah,
thought
focus on the
about using a
positives.
validated tool to also collect quantitative data?
Yeah, or we can just let Kelly ask that question, actually. Kelly, would you want to just ask that question real quick? Kelly Fox?
Sure, if I can learn how to unmute my mic regularly. Yeah, I was just asking, have you thought about collecting some quantitative data as well using a validated instrument? I love the qualitative piece. I think that that's quite amazing. And but I was just curious, have you thought about using a validated instrument like the IPEC or something like that to collect some quantitative data from your students as well?
From
Yeah.
our patients, I will let Fernanda answer this question.
Please, Mari, you can say.
At the beginning, we prepared questionnaires with the inventory from pain. It's a validated questionnaire for patients. So we have this data and we are analyzing it as well. So it's a mixed questionnaire. So we have qualitative and quantitative data. And to complement my answer, I will ask Fernanda to talk about the students.
Thank you, Mari. Yes, Kelly, we tried to combine qualitative and quantitative data. We also use for this psychoeducation group about the sleep quality health for the patients. They respond the Pittsburgh questionnaire inventory, and we are analyzing this data too. Yes, we collected, this was very interesting. We collected this data in 2023, and this year with the same patients, one more time as trying to follow up these patients about the quality of sleep. Yeah. And the data is very interesting. We have the hypothesis that the aspects of the psychosocial support, they hadn't these in this period between 2023 and 2025, they hadn't the psychoeducation groups. They reported to us that some of them, they have difficult to go to sleep because of family problems and financial problems, and we are looking these to this possible association, and we of course will need more studies about it, but we thought about this relation between the social support which these psychoeducation groups could provide for these patients. We had the questions, we don't know, but maybe if they had these encounters monthly, maybe could be a variable that could benefit the sleep quality. That was a question. So we utilized the validated inventory about the chronic pain and sleep quality, and we tried in the psychoeducation groups to develop a questionnaire before the psychoeducation groups and after that. We have this descriptive data about the answer. For example, knowledge about pain for the students and patients. We tried to look, could they benefit from learning about pain in these psychoeducation groups. But we had a very small group. The groups was with 7, maximal 10 patients. So we have this bias that our group was very small.
Thank you for that. I really appreciate it. I was actually asking about the student learning outcomes, but this is also incredibly interesting. Thank you.
Yeah. So Sweat Nisha asked, what are the challenges while conducting the qualitative part of the study? So, what kind of challenges did you have?
Thank you for the question. May I just compliment the answer for Kelly, because it was actually our big question, and that's that leads us to interprofessional education. Because how could we define our learning objectives to evaluate our interprofessional competencies? So what would you like to teach the students, the patients, and how could we evaluate them, and how act and review our process from our data that it's about to come that can. So I hope I could answer. About the challenges from conducting the qualitative part of the study, I would like to invite Fernanda to tell about the process, because she was wonderful with the analysis from the data and to measure about the words and the context from the statements from the participants, both patients and students?
Yes, we analyzed the qualitative data. We had two students involved in this analysis, I and Mariana, and we did it three times this process. One time, and we had this process not to realize the thematic content analysis. I think the biggest challenge was the time for doing the research in parallel with our work as professor, as health professional, and this had this took more than 1 year. Yes, Mariana, in this analysis, and we are working on it. And I think our biggest challenge was the time to do it. Was a biggest challenge to for us. We had as professor in the university, we had a half hour per week to do research, and that was a big challenge for us.
I think you had a great presentation, and we really appreciate it. We appreciate everyone's patience with the Zoom link. Sometimes those kind of things happen. We don't like it for them to happen, but we pivoted just like the research team did. But we appreciate everyone's patience. This will be posted on YouTube, and we will send things out via social media when it's ready to be watched. But on behalf of Interprofessional.Global, I want to extend our sincere thank you to Mariana and Fernanda for a fantastic presentation and a very, very promising program with real concrete clinical outcomes for patients and learning outcomes for your students. So thank you very much. We really appreciate it.
Thank you. Thank you very much for the opportunity.
Yeah, thank you. Congratulations and happy holidays, everyone. Enjoy your holiday season. Thank you.
Thank you. Thank you very much.
Bye-bye.
Bye-bye.
Thank you.
Thank you.
Thank you.
Bye-bye. Bye.
Bye-bye.
Bye.